Our next story, A Weekend in Palermo, is a short saga about our medical student Alice becoming less naive and more streetwise. There's no such thing as a free lunch, as they say, and it seems all the extra surgical training Alice was receiving in Oxford came with a price tag attached. Listen to the very end to see how Alice fares during this trial. Let's get started. A Weekend in Palermo, Oxford, July 1977. I'm completing the young girl's appendicectomy with a beautiful, continuous subcuticular suture. That's the way, Dr. Randall said quietly to me. We'll make sure she'll have a very tiny scar that no one will notice. I'm feeling really pleased with myself as I complete suturing the incision. This is the first full appendicectomy that I have ever performed myself, and I'm only a fifth-year medical student. Dr. Randall, the consultant surgeon of the unit, has been instructing me every step of the way. So really, I didn't do it. My fingers and hands held the instruments, true, and performed the incision, ligation of blood vessels, isolating the appendix and removing it, and finally closing the incision. But I couldn't have done any of it alone. I didn't really know what to do. It was Dr. Randall who is the specialist surgeon, and he's guided me right through the operation to its successful completion. I'm in the middle of my 6-week surgical elective at the Radcliffe Infirmary, Oxford University, Oxford, UK. 2 other male medical students, Andrew and Frank, both from my medical school in Australia, have come with me. We are all in our 5th year of medicine at Monash University in Melbourne. It's the end of the operating list now, and Dr. Randall is walking out of the operating theatre with me, back to our respective change rooms. He's been so good to me since I started on this surgical unit. He's taken me on ward rounds and explained everything important to me about the patients. I started by assisting him with all his general surgeries, and now, this last week, I have performed 2 surgeries where I was the principal surgeon, under his guidance, of course. A varicose vein removal, and now an appendicectomy. I've definitely been given special treatment. Both my friends, Andrew and Frank, haven't been invited on these special ward rounds, and neither of them have been able to do an appendicectomy. They've been merely assisting their consultants in surgery. You're doing very nicely with your surgery, Alice. I'm sure you will do a lot more surgery with me over the coming weeks, Dr. Randall said. I was thrilled to think I would get even more surgical experience at the Radcliffe. No medical students ever got to do surgery on these types of cases at home in Melbourne. In Melbourne, you would only get to do assisting, not the actual surgery. You didn't get to do the actual surgery until you were a fully qualified doctor and in a surgical training program. Dr. Randall continued on in his usual casual, friendly style. Would you like to join me this weekend for a few days in Palermo? I think you would like it, he suddenly said to me. I was totally shocked and taken aback. I couldn't believe what he just said. A weekend in Palermo? With a surgeon? With Dr. Randall? He had to be 45 years old, I'm thinking hurriedly. And I know he's married with 2 kids. I'm 21. What the? I couldn't say any of this to him, of course. So I just said, oh, I'm not sure. I replied in a little voice that I could hardly hear myself. Where had that come from? What was he thinking? Sure, he said confidently. Give it some thought. How about I meet you this evening for a drink around 8? We can meet at the Blue Boar, if you like. Oh, sure. I'll see you then. I trailed off, and then I slunk away as fast as possible into the ladies' change rooms to get out of my scrubs. After changing into my street clothes, I left the surgical suite in haste, hoping I would not run into him again before I got out of the hospital. Thank goodness I didn't see him. I walked straight back home to my bedsit where I was staying. It was basically the attic of an old lady's house, a room she rented out, but it was close to the hospital, cafes and food stores, so I found it very convenient. When I got back to my room, it was 6 p.m. 2 hours to go before I had to meet him again for a drink at the pub. These 2 hours seemed to go by very slowly and were spent in fear, ruminating on what was going to happen at the pub and ruminating about the possible weekend in Palermo. How did I get myself into this? What are we going to talk about at the pub? And even more important, what does he think we will be doing on the weekend in Palermo? What do I think we will be doing in the weekend in Palermo? I'm imagining maybe going for walks, seeing the sights, swimming in the hotel pool. Italy, right? Palermo is in Italy. It seemed like a long way to go for a weekend. Then it all fell together in my mind. Yes, he thinks we're going to have sex. Yes, sex. I don't even know what that looks like. I'm a naive 21-year-old medical student, and he's a 45-year-old cheater on his wife. He's probably taken plenty of nurses to Palermo for other weekends. And am I just another sitting duck regarding this whole situation? Do I have to meet him at the pub? He is my consultant after all, and I need to get a good elective term report from my supervisor. Luckily, I'm thinking, he's not my actual supervisor. It's Professor Cornell, the head of the whole surgical unit. He'll be doing the sign-off. But I can't really get out of this meeting Dr. Randall at the pub when I said I would. I walk into the Blue Boar at 8 p.m. and there he is, seated at the bar with a drink in front of him. "Will you have a drink?" he asked me. I'm thinking, I usually don't drink anything. A lemon squash will be fine, I say. We chat at the bar for about 15 minutes. I don't think I've said very much at all during this time. Just something stupid about my friends and our elective, maybe. He's finished his drink now. He doesn't order another. He doesn't look at me. "You're very young, aren't you?" I hear him say, looking straight ahead. There has been no mention of Palermo. I say nothing. "Tell you what, I'll take you home now. It's getting late," he says. I'm thinking, it actually isn't. It's only 8:15 p.m. Back in his car, I'm in the passenger seat, and he doesn't lay a hand on me or say anything to me on the short ride back to my lodging. Thank goodness. Once we're back at my lodging, he opens the door and we say goodbye, and that's it. He drives away. No more said about Palermo, the weekend, or anything. In fact, for the rest of my elective at Oxford, he ignored me completely. He never spoke to me again, took me on a ward round or asked me to assist him with operating. I was relegated to the big ward rounds again now, with my two other medical student friends, Andrew and Frank. And I just assisted at surgery with the other surgeons in the unit. Never again was I invited to assist Dr. Randall. "I see you're not operating with Racy Randall anymore, Alice," my friend Frank said to me. "Seems like he's taken a shine to one of the nurses now. Follows her around everywhere. You obviously didn't come across with the goods." "I didn't know he was known as Racy Randall," I replied. "And no, Frank, I obviously did not come across with the goods." That's the end of the story. Thanks for listening. For more stories, go to my YouTube channel at Dr. Diane Leslie Webster, or you can read my novel called 4 Ways to Die at Riverside Towers which is available on Amazon as a paperback or an ebook on Kindle. I hope you have a really lovely day today and go outside for a time.